Hi, today we're going to be doing an oral speech mechanism screen on Ronnie. He's going to allow us to check the face and the mouth for functionality of the structures. So we're going to start, Ronnie, by having you look straight at me. I'm right now checking the symmetry of your face. And what we're looking for is that it is symmetrical, and it is, so that's very good. The next thing that we're going to do is I'm going to have you smile and say O-E, O-E, O-E.
O-E, O-E, O-E.
Thanks, excellent. Pucker your lips like you're going to give a kiss. All right. And open your mouth and move your jaw from left to right. Okay. I feel like you're not moving your jaw, but your lips can actually shift. Okay, great, thanks. All right, what we're going to do next is I'm going to have you close your lips really tightly. Very good. Now puff out your cheeks, please, and see if you can hold that when I squeeze. Great, nice job. We don't want to see any air escaping, and we didn't. Nice job. The next thing I'm going to have you do, and the last, is to bite your lower lip. Excellent. Yeah, it's great. All right. Now we're going to go inside of your mouth and we're going to have a look at the tongue. What we're looking for here is the size, the color, the symmetry, that sort of thing. So go ahead and open your mouth, and I'm just going to grab my flashlight and have a look inside. Sorry, I can't find my flashlight. Give me just a second. There it is. Things roll. All right, so I'm going to have you open. Excellent. Again, what I'm looking for is just the color, the symmetry of your tongue, any unusual landmarks. Excellent. The next thing that I'll have you do is stick your tongue straight out. You know, like you're going to stick your tongue out at somebody. All right, straight out. I'm going to have you move it from left to right. Open your lips when you're doing this. They don't need to be puckered, so I'll let that tongue free. There you go. Awesome. And then I'm going to have you elevate your tongue. So what I mean by that is, you know, if you had peanut butter on the roof of your mouth and you were going to lick it off,
Yeah.
see if you can lift your tongue in that manner. With the base of your tongue, like the whole top of your mouth is covered in peanut. There you go. Now just hold it up there. Excellent. That's great. All right. Now what I want to have you do is, again, I'm going to have you elevate your tongue where you just lift it straight up. All right, good job. The last thing is you're going to push your tongue against the side of your cheek just as hard as you can. All right, other side. Nice and hard. Awesome. Very good. All right, next thing that we're going to look at is your teeth. So I'm going to have you open your mouth and open a little wider if you can. That's great. Thank you. I see you still got your wisdom teeth. All right. And again, just looking for anything unusual. Sometimes we have teeth that are turned in different directions. Don't see any of that here. Your teeth are nice and symmetrical and even. All right. So, one more time, I'm just going to peek back there. All right. Very good. All right. Now I'm going to do a little more inside the mouth work here. I'm going to feel your hard palate. So that's just the roof of your mouth, basically, where the bone is hard. So if you'll open up nice and wide, I'm just going to run my finger over this ridge. Thank you. I know that feels strange. Thanks for bearing through that. The next thing that I'm going to do is I'm going to look inside again. I'm going to look way far back so that I can see the soft palate, which is all the way back where you swallow, okay? So go ahead and open up nice and wide. Stick your tongue out for me. All right, great. Now, can you say ah, oh, ing? Good. Very good. What I'm trying to do is see if the velum is opening and closing so that you can create that nasal sound. Exactly. Ah. Excellent. Thank you. All right. The next thing I'm going to do is I'm going to go a little further back, and I'm actually going to touch that soft part of your mouth, because what I'm trying to do is elicit the gag reflex. Looks like we got it pretty quickly there. Thanks. Sorry about that. It's totally normal and healthy, of course, to have that reflex.
I would have actually warned it.
Yeah, I told you I was going all the way back. The next thing we're going to do is talk about and have you talk to me so that we can actually see the speech and how that functions inside of this space.
Okay.
So I'm going to have you make this sound for me. 16. Well, I'll just tell you when to stop. How's that? I'm going to have you make it in rapid succession until I tell you when to stop. So it'll be pa, 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 just like that.
Okay.
Go ahead and begin.
Pa 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 pa.
Good job. All right, we're going to do the very similar activity, catch your breath. And it's going to use a different part of the mouth. We started with the lips. Now we're going to move back a little bit inside of the mouth, and we're going to hit that ta, 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 ta. And you can go ahead and begin whenever you're ready, and I'll cue you when to stop.
Ta 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 ta.
Good job. All right, next we're going even further back, all the way to the soft palate, and it's ka, 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 ka. All right, so on your mark.
Ka 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 ka.
Good job. All right. We'll give you a second to breathe and regroup. We're going to do a combination of the first two sounds, the one that started here on the lips, pa, and then the one that was right behind it, ta. So it's going to be pata, 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 pata. Rapid succession, whenever you're ready, and I'll let you know when to stop.
Pata 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 pata.
Very good. All right. And now I'm going to combine all three of those sounds, and I will cue you when to stop. You can start when you're ready. It'll sound like pataka, 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 pataka. Ready? All right. Whenever you're ready.
Pedica, 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 pedica,
Very
pedica,
good.
pedica.
Awesome. All right. And that concludes the oral mechanism exam. Thank you for participating.
Oh.
We appreciate that. Thanks.
Pedica, pedica.